Good day, clinical instructors. My name is Marjorie M. Dela Rosa from BSN 1A, and in this video, I'll be performing the proper procedure on assessing the neurological systems. So before proceeding with the assessment, I'm going to be doing these things first. First is to assemble the necessary equipments, and next is to introduce yourself and explain to the patient what you're going to be doing, why is it necessary, and how can he or she cooperate. Then we're going to be washing our hands and observe other appropriate infection control procedures. Then I am going to be doing providing the client privacy. Then we're going to be determining the client's history on the specific assessment area. Good day, ma'am. Okay, so you are Miss Maddie Pa, am I right? Okay, so I am Marjorie M. Dela Rosa. I am a student nursing here, and today I'll be assessing your neurological system, okay? Okay, so ma'am, before we start, I want to let you know that before coming in here, I have already washed my hands. Is that okay? Okay. So, before we start in the assessment proper, I want to ask you some questions first, okay? We will be determining your history on the specific assessment area that we're going to be assessing today, okay? Okay. So, ma'am, do you feel anything wrong with your, like, any headaches? No naman, okay. Any memory loss in the past few days? Have you observed that you kept on forgetting a lot of things? No? Okay. So, ma'am, do you have any problems with your orientation, like how you see things, or do you have any problems with your taste, like that, ma'am? No? Okay. So, ma'am, do you have any history of any surgeries or any other complications that is related to our assessment today pa? No? Okay pa. Sige, thank you. So, I will just be getting some stuff and we're going to be proceeding to our assessment, okay? Okay pa, thank you. Okay, so I am back with our things in here. So what we're gonna be assessing first is in your neurological system is your language. So in this assessment, I have prepared some printed and words and pictures. So in here pa, now I am asking you to read and match them. Okay, so what we're gonna be doing is reading them first. Okay. So for this one, can you read this one po? It says, smile. Smile. Okay, so that is good. So next is the, here, this word. Star. Okay. So that is good. Now we have this one. Mom? Flower. Okay, so it is, yes, it is a flower. So what we're gonna be doing is we're gonna be matching them. So with the corresponding word, there's gonna be a corresponding symbol or a picture, okay? So I'm gonna lay them flat in here for you to match them. So I'm gonna be scrambling it there. Hold on. Okay, so ma'am, come here po. Okay. Okay, so in here, I want you to match it first, okay? So, where is the word? Okay, right, you're gonna be matching them. So this one, smile. Where's the symbol for smile? This one, smile. Okay, so that is good. Now, next is just pick up anything that you want, okay? Okay, this one. And which one? This one? Okay, flower. Okay, so of course the last one we have is the star and the star. Okay, so that is very good now. Sit down back here. Okay, so that is good. Next is that I will be saying simple and verbal or written commands, and I want you to be doing what is told. So, ma'am, can you please give a high five? Okay, so that is good. Ma'am, can you please stand up? Okay, now you can sit down back, ma'am. Okay, so that is good. So now is that now after all this test, I will be seeing if you have any difficulties in the test that we did, and as I saw, there is no difficulty. So now, if in case that there is a difficulty, what we're gonna be doing is that we're gonna be pointing on the common objects that we see in the room, and we're gonna be asking the patient to name what are those things. So in here, let's just give this for an example. Ma'am, what is this pot? This one. This one. Iron. Okay, so it is an iron. That ma'am is right. Now, how about this? Cologne. Okay, so it is a cologne. So now, as we saw, ma'am is doing, the client rather, is doing just fine for the language test. Okay, now is for the orientation. So now for this, we're gonna be, let's ask the client some questions to test the client's orientation. So it's gonna be a series of questions. So, ma'am, I will be asking you a series of questions, and you just have to answer based on what you know, okay? So, now, first is, do you know what time it is? 12:30 p.m. Okay, yes, it is 12:30 p.m. Now, do you know where you are now? Clinic. Okay, yes, you are at the clinic. Now, can you tell us who you are with when you came inside? My mom. Yes, okay, you were with your mom. Now, can you tell me where you live? Catalonan, Pequeña. Okay, yes, you live in Catalonan, Pequeña. That is good. So now, you can put on your hands. Okay, so now, how many are you in the family? Five. Okay, you are five in the family. Now, again, do you know where you are at right now? The clinic. Okay, yes, you are at the clinic. Okay, last na ma'am. Do you know what day it is today? Sunday. Oh, yes, okay. It is Sunday today, so that is good. The orientation of the patient seems to be doing just fine. Okay, it's just perfect. So now, as we can also see, is that the patient did not hesitate or took a very long time to respond. So that is a good sign of a good orientation of the patient or the client. Okay, so now we're gonna be testing the client's memory. So in this, we are going to be asking them questions as well. Okay, so what we're gonna be doing in here is just listening to the lapses in the memory as we ask the patient or the client questions. Okay, so what we can do in here is that we can also ask what is the patient, what can the patient see in this room, or what did the patient remember upon entering the building, like that. Okay, so now when we know that, also maybe the patient may be hesitant to answer, or that is a sign of they are not sure of the answer what they're going to be answering. So that is how we can determine the lapses in the memory of the patient or the client. So now, yes, we're going to be asking questions again. So now, ma'am, I will be asking you a series of questions. So this will test if you have any difficulty in your memory. So there's going to be three categories for this. So we're going to be doing the first one. Okay, that is the immediate recall. So for this one, I just want you to repeat the series of three digits that I will be saying to you, and I will be speaking it slowly so you can remember it. Okay. Okay. So, ma'am, I want you to say the numbers 743. Again, 743. 743. Okay, so that is good. Now I will be increasing it. Okay, so from three digits, I'm gonna be making it four digits. Okay, okay. So now say 7 3 4 5. 7 3 4 5. Okay, so that is good. I'm gonna be increasing it again. So now is 7 4 3 5 6. Again, 7 4 3 5 6. Okay, say it, ma'am. 7 4 3 5 6. Okay, so that is good. Last na, ma'am. Okay, so 7 4 3 5 6 7 2. Again, 7 4 3 5 6 7 2. Ma'am, please repeat. 7 4 3 5 6 7 2. Okay, so that is very good. Okay, so now what I'm gonna be doing is that we're now say the series of digits again, but can you repeat it backwards, pa? Okay. Okay. So we'll start with 1 2 3. Again, 1 2 3. Backwards, ma'am. 3 2 1. Okay, so I'm gonna be increasing it. 4 5 6 7. Again, 4 5 6 7. Okay, you, ma'am. 7 6 5 4. Okay, so that is good. Next is I'm gonna be increasing it again. 8 9 10 11 12. Again, 8 9 10 11 12. You, ma'am. 12 11 10 9 8. Okay, so as we can see, the patient has responded quickly. So that is a good sign of memory for the intermediate category. So now we're going to be proceeding with the recall memory. So this is where we're going to be asking the what just recently happened. Recent memory rather. Okay. So now in this category, ma'am, you're going to be answering questions again and trying to recall what happened just recently. Okay? Okay. So now we're going to be asking the patient to recall recent events of the days. So in here, we're going to be starting with questions again. Okay, so ma'am, can you tell me how you got to the clinic? I got to the clinic by the car from our house. We went first in the mall, then we went to the clinic. Okay, so that is good. As we can see, there is no hesitation in answering, so that is a good sign of the recent memory recall. Okay, so now, ma'am, I'm gonna be asking you, can you tell me what my name is? As I said earlier, I have said my name and that I am a student nurse. Can you please recall? Let me think about it. Okay, I'll give you a second. Oh, I know. Oh, you know already? Okay. My name is. Your name is Marjorie Dela Rosa. Okay, so that is good. So even though it took a bit of a while for the patient to answer, that is just fine. It's not like the patient has already really forgot my name and my name is not showing here. So that is a good sign of a good memory recall. Okay, so now what we're gonna be doing is the third category, the memory. So in here, we're going to be asking the patient a question again. So, ma'am, can you please describe the previous illness or your surgery, or did you have any previous illness that caused you to have surgery or anything? Okay. Um, Wait, give me a second. I'm still trying to think about it. All right. I had dengue. So I had to be admitted in the hospital for a few weeks. Oh, okay. So I'm sorry for that, ma'am. So I'm glad that you have already recovered from that. Yes, thank you. Okay, so as we can see, they have a remote memory where they try to recall something that is in the past already, not a recent memory. So with that, we can say that the patient has good memory. There are times that the patient is hesitant or just has a slower pace of answering, but as long as the patient has already remembered those things, and I think the patient has good memory naman. Okay, so now what we're gonna be doing is that the attention span and the calculation of the patient. So in here, it's just a series of comments and questions again. Okay, so ma'am, can you please recite the alphabet for me? The Filipino one or the English one? The English one, ma'am. Okay, so the English one. Okay, so so A B C. Can I sing it? Okay, yes, mom, you can sing it, of course. No problem. Okay. A B C D E F G H I J K L M N O P Q R S T U V W X Y and Z. Now I know my ABC. Next time, won't you sing with me? Okay, that is very good, ma'am. Okay, you memorize your alphabet. Still memorize the alphabet. That is very important. Okay, now, ma'am, can you add two from zero? Okay, so starting from zero, add two, add two, add two until you can't anymore. Okay. Okay, that's a bit hard. I'm not good at math, but I will do it. Okay, that's okay, ma'am. Okay, start na po. Okay. 0, 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 28, 20, 30, 32. Okay, ma'am, that's okay na po. Okay. So, that is good. She has a good attention span and the calculation is quite good, yes. Okay. So now what we're gonna be doing is assessing the level of consciousness of the patient. So we're gonna be assessing this by observing how he or she or the patient answers our questions. So as far as we could tell from our previous questions in the previous test, the patient has good consciousness naman. She is responding well, and I will just be asking, ma'am, do you feel okay today po? Do you feel any dizziness or anything? No naman. Okay, so the patient is not feeling any illness today or sickness. So that is good. So the level of consciousness of the patient is a perfect one. So she is conscious. So now we're going to be assessing the cranial nerves of the patient. So first is the cranial nerve 1, that is the olfactory. So ma'am, I have in here a cologne. So this cologne is this one. It is fruity fave, and it has a watermelon for women. Okay. So I bet you did not hear that, ma'am. But in here, I have a cologne. So in this cologne, we're gonna be testing your olfactory, okay? So I'm gonna be spraying some in the air. Okay, can you smell it? Okay. So ma'am, with that smell, can you please describe the smell? Uh, it smells fruity. It smells like for girls. I think this is from Pen Shop. I used this in my high school days. Uh, is this a watermelon cologne? Yes, ma'am, you are right. It is a watermelon cologne from Pen Shop. So, as we can see, the patient's memory is good from that also. And the olfactory is also correct. She has smelled the watermelon scent in that cologne. So, that is good. Ma'am, did you smell anything that has a bad smell or anything that's something wrong? No, no, man. I just had a hard time to describe it because I have a lot of things in my mind, so it's a bit grumbled up. But I'm glad that I got the right answers. Yes, ma'am. Yes, you should be glad that you had the right answers, and your memory is pretty good, and your sense of smell is pretty good. Okay. So next is the optic. So in here we're gonna be reading letters in the Sunland chart. So ma'am, as you can see in there, you can see there the Sunland chart. Can you please read the letters? So the first letters rather is P. Okay, that is in the first line. The second line, F, P. Okay, that is good. So next, the third line, P, O, C. Okay, so that is good. Next, the fourth line, L, P, E, P. Okay, so that is good. Next, P, E, C, F, E. Okay, so that is good. Next, the sixth line, E, D, F, C, Z, P. Okay, that is good. The seventh line, can you still see? Yes. Okay, ma'am, can you tell me what it is? F, E, L, O, P, C, E. Okay, that is good. Next, can you still see the next one? Yes. Can you tell me what it is? T, E, F, P, O, P, E, C. That is very, very, very good, ma'am. Next, can you still see the small letters na po? No, I cannot anymore. Okay, so that is fine. Okay. So, in there, normally, if you have really good eyesight po, you could see it actually. Like, for me, I cannot because I already have glasses. And in those glasses, I think my grade is a bit higher. So, I think I have to replace my glasses already. But normal people with a 20/20 vision, they would be able to see even the smallest letters in the last line. So that for that one, ma'am, I advise you to go to the eye doctor or there. So sana po mapaayos natin yung eyes niyo po, no? Okay, so now what we're gonna be doing is the cranial nerve number 3. This is the oculomotor. So in here, can you please follow the direction of my hand to test your ocular movement? This can also be tested in the cranial nerve number 4. This is the Thor here. Okay. So in here, just please follow the direction of my hand, okay? Okay, we're gonna position it in here. Okay. So please follow this step. Okay. Up, down. Okay, side. Okay. Okay, so that is good. So as I can see, you have followed it pretty well, and your pupil reaction is pretty fine. Okay, so we're gonna put you back in there. Okay, so now what we're gonna be doing is testing your cranial nerve number 5. This is the trigeminal nerve. So in here, can you please look up po? And once you look up, I will be lightly touching your eye. So to elicit the blink reflex, okay? In here, we want you to blink, ma'am, okay? Okay, so please look up. Okay, the patient blink. Okay, so that is good, you blink. Put this there. Okay, so now what we're gonna be doing is your descents in here. So in here, we're gonna be assessing the direction of your gaze. Okay, ma'am, can you please look there? Okay, in here. Okay, how about in there? Okay, so that is good. So now we're gonna be testing your cranial nerve number 7. Oh, the other one is 6. Okay, this one is the 7. Your facial. So ma'am, can you please smile? Smile. Okay, so ma'am, can you please raise your eyebrow? Like taas ang eyebrow, punat ang noo. Okay. So now, can you please frown or parang look disgusted or look disappointed or look sad like that? Please frown. Okay. So now, can you puff your cheeks like inhale air but trap the air inside? Okay, so that is good. Next is now to close your eyes tightly. Okay, you're closing your eyes. Okay, you can open them now. Okay, so now we're going to be testing your cranial nerve number 8. So that is your auditory. So now we're going to be using a tuning fork to test the vibration and ability to hear. Okay, so in here we're going to be using the tuning fork. Wait lang ma, I'm just going to be getting it. Okay. Okay. Tuning fork. Okay, now we're back with the tuning fork. Okay, ma'am, can you please just move forward a little bit? Okay. So, yeah. Can you feel po the vibration? Okay. So, in here naman. Okay. Okay. So this is good. Now what we're gonna be doing is to what's the pen? Okay. What we're going to be doing is testing your glastopharyngeal. Okay, so now can you please move show your tongue po? Okay, so move it from side to side. Okay, then up and down. Okay, so that is good. So now is your vagus. Now for this is the cranial nerve number 10. So in here, we can assess this by the patient's speech for hoarseness. Okay, ma'am. So can you say for your name and your favorite color? Okay. Okay. My name is Dela Rosa, and my favorite color is blue. Okay, so as we heard in the patient, there is no hoarseness or there is no huskiness in layman's term in her voice. So that is good. It's just very high. She has a very girly voice, but she doesn't have any hoarseness. Okay, so now we're gonna be testing your cranial nerve number 11. So in this pala, ma'am, I forgot to inform you, but this is 12 cranial nerves. You have 12 cranial nerves. So first is the 11th rather is the accessory. So in here, can you please shrug your shoulders against my resistance of my hand? So I'm gonna be putting this here. I want you to shrug your shoulders. Okay, so that is good. Now I want you to be turning your head from side to side against again the resistance of my hand. Okay? Okay. Okay. Another the other side. Okay. That is good. Wait, my pen. Okay. So that is the accessory, the cranial nerve number 11. So now the cranial nerve number 10. This is the hypoglossal. Okay, so now ma'am, can you please show your tongue? Then move it from side to side again. Okay, so that is good. So now we have completed the cranial nerve assessment for the neurological systems. So now we're going to be proceeding to the next one. So next in the neurological system assessment is the reflexes test. So we're gonna be first doing the biceps and the triceps, then we will move on forward. So for this one, to test, I'm gonna be using a percussion hammer. Pero since I don't have a percussion hammer, I'll be using this one. Yeah. So, and we're gonna be doing when we do it the other side, we're gonna be comparing it in the other side as well. So, this is to evaluate the symmetry of the response. So, for this one, we're gonna be starting with the biceps. The bicep reflex tests the spinal cord level C5 and the C6. So for this one, we are going to be partially flexing the client's arm at the elbow in here, and rest the forearms in here in the over the thighs of the patient. So placing the palm of the hands down. Okay. So for this one, we're also going to be placing the thumbs of our non-dominant hand, in my case, the left hand horizontally over the biceps, like in here, bicep tendon in here. To find that one, just flex it a little bit, then you can feel it actually while it's moving. So mine is here. Okay, so now what we're gonna be doing is once we locate that one, we're gonna be delivering a blow. Sorry, delivering a blow of the percussion hammer to your thumb, and observe. Once we do that, we observe the normal slight flexion. So once it is parang hammered in here, parang a slight blow, it will be like that a little. Like there's gonna be a little flexion for that one. So, and we're gonna be feeling the bicep contraction through your thumb. So in here. So since our I'll be doing it in tall first, and I'm gonna be doing it in myself, so you can see the flexion. So for this one, we have the patient in here. So in there. Okay. So what we're gonna be doing is put the hands first in here and slightly open this one. And in here, we're gonna be locating the elbow. So in here, this is gonna it's in here for the dog. Then put your thumbs over, then there, blow it. Then the other side. Okay. So it's gonna be like that for the dog, pero I'm gonna do it in myself so you can see the slight flexion. So in here, it's gonna be, you have to relax the arms. Okay, so in here, find the bicep tendon in here. So I will be doing it directly because I cannot in here. So in here, with this one, just slightly. Okay, other side, it's in here. Okay, again. Okay, so there is this slight flexion that we see in the normal finding when we do the bicep reflex. So as we can see, it did reflex. It did flex a bit. So now we're gonna be doing the triceps reflex in here. So this is our triceps in here. Here. Okay. So this tricep reflex tests the spinal cord level C7 and BC8. So what we're going to be doing is to flex the client's arm at the elbow in here, like that, and support its palm of your non-dominant. Okay, like that. So it's going to be like that. When we sorry when we do this, so always remember to always ask again permission from your patient, or please inform them that you're going to be touching them, because they might be uncomfortable with you holding their hand or holding their arm. So always ask that permission, okay, consent also. So going back, what we're gonna be doing is flex the client's arm at the elbow like that, and support its palms of your non-dominant hand. Then we're gonna be palpating the triceps tendon about 2 to 5 centimeter, or 1 to 2 inch above the elbow. So from this one, just 2 to 5 centimeters, so around here lang. You can feel it rin naman when you flex a little. Then there you can feel it. So what we're gonna be doing is, after locating it, the tendon, we're gonna be blowing direct, deliver a blow with the hammer percussion above the elbow to the tendon. So directly to the tendon, and observe the slight extension of the elbow. So it will be like that. Okay. So for our reference in here, so imagine it's like gonna be like that. So once you locate it in here, then side. Oh, like that, the other side. Okay. So there. So in my case, if it's gonna be in the real human, so slightly flex the elbow there. So feel where you're gonna be hammering in here. Above the elbow, above the elbows, and there. So here, okay, and here. Okay. So it kind of moved, it kind of extended a bit. So that is a normal response. And there are some responses where it's really not responsive. It can mean a lot of things. I have read there's going to be like this shortness of the muscle and some other condition. So um, it is normal to have a reflex on it. That's why we're testing it. Yeah. So once you have that one, make sure to relax the hands of the patient, the arms of the patient, to proceed to the next reflex test. So, so next we have the brachiolateral reflex. This has the spinal cord level C3 and C6. So for this one, we're gonna be the rest the client's arm in here in the relaxed position on your forearms. So it's gonna be like this, like that. So, or on the patient's own leg. So it can be its own leg in here. So when done that, what we're gonna be doing is delivering a blow with a hammer, percussion hammer, directly on the radius 2 to 5 centimeter there, or 1 to 2 inches above the wrist, or the styloid process, and the bony prominence here on the thumb side there of the wrist. So here, there. So now what we're gonna be doing is, once it is percussed, we're gonna be observing the normal flexion and supination of the forearms, and the fingers of the hand may also be extended slightly. So there might be a slight extension. So for this one, for the doll's preference in here, so it's gonna be like the palm is open there, then in here, like that, or in here, like that. Okay, so but in a normal person like me, it's gonna be like this. So make sure the arm is relaxed in here. So again, this is this one in here. We're gonna start with my left. One. Okay, so there was this flexion. The other side. Okay. So there. Now we're going to be doing the patellar reflex. This tests the spinal cord level L2, L3, and L4. So for this one, we're going to be asking the patient or the client to sit on the edge of the examining table in here. So the legs would be hanging freely. Okay. Then we're going to be locating the patellar tendon directly below the patella. So in a normal person, it's going to be, this is the patellar in here. Okay. Then what we're going to be doing is deliver a blow with the percussion hammer directly to the tendon. So what we're going to be doing is observe the normal extension or kicking out of the leg as the quadricep muscle contracts. So for this one, in the doll's view, so it's going to be like this. So this is the patella. So this is the tendon. So let's say that the doll is sitting down. So once it's like this, it's gonna be slightly extended there. There, like that. Okay. So, but in mine, in the of the person, it's gonna be like this. In the side of the table. So it will be hanging freely there. So this one, patella, and here. So, okay, like that. The other side. Like that. Oh, there. So next, what we're going to be doing is the other one. It is also going to be around the ankle area. So for this one, this is the Achilles reflex. Back that off. The Achilles reflex. So this tests the spinal cord level S1 and S2. So for this one, with the same position as the patellar reflex test, what we're going to be doing is it's going to be slightly dorsiflex. It's going to be parang nakaganon na feet. So the ankle supporting the foot lightly. What's this? And the hand. So we're going to be holding the foot. So for this one, we're going to be directly deliver a blow with the percussion hammer directly to the Achilles tendon, just above the heel, and observe and feel the normal plantar flexion or the downward jerk. Like it's going to be, for example, this is your foot. You're going to be doing this directly here, like the tendon in here. Then it's going to be like that slightly, like that. So for this one, for the doll, it's going to be like, I'm going to take off your shoes, okay? Okay. So we're going to be partially just hitting this part. So like that. Like that. But in our case, in the human's case, it's gonna be like this. Wait. Okay. So for this one, it's gonna be like this. So it's gonna be like that. Like that. So with this one, it's gonna be there. Okay, like that. Other side. Right. So it is like that. So, with that, we have completed our reflex test for the neurological system. So next, what we're gonna be doing is to test the motor function, the gross motor function, and the balance tests of the client. So first is the walking gait. So we're gonna be asking the patient to walk across the room, and as they do that, we're gonna be assessing the person's gait, or the how the person's posture is when walking. So I'll be pretending that I am with the doll. Okay, so ma'am, can you please walk across the room? Okay. Okay. So as we can see, the client rather, is walking across the room with no difficulties. We can see that there's no limping, or there's no difficulty in parang the balance of the client. She's not falling down or parang swaying while walking. So next, we're gonna be doing the Romberg's test. So what we're gonna be doing is asking the client to stand with feet together and with arms resting in the side, or the para siyang anatomical position. Ganon, pero the feet are closed. So with that, we're gonna do it with eyes open first, and next is with eyes closed. So I'm gonna be pretending to be the client or the patient. This is with eyes open. So as you can see, the body is straight as it should. There's no swaying or anything. Or while standing with feet together, there's no difficulty in standing. So just straight. And with eyes closed, there's none. Okay. So that is how the Romberg's test is done. Next would be the standing on one foot with eyes closed. So as explained, this is pretty understandable. So what we're gonna be doing is ask the client rather, to close his eyes or her eyes and stand on one foot, then the other, stand close to the client during the test. So to make sure that they are not falling, or if there's any difficulties, that they're not gonna be hurt once they fall or something. So I'm gonna again be pretending to be the patient. The client rather. So first is standing one foot, eyes closed. Okay. The other side, eyes closed. Okay. So from this one, what I observed for myself, and this can happen to a client as well, while standing up with one foot with eyes open, the balance can be there. See, the balance is just normal. But once you close your eyes, in there you start to feel more anxious that you're gonna be falling anytime soon, because again, you can't see what's surrounding you. So with that, you can feel yourself to be leaning to the other side, and it is common to have the unstable. It's gonna be unstable. So that is normal naman. So with that, maybe the balance of the person is not that great, or in my case, not that great. So next would be the heel-toe walking. So from the heel, then toe. Okay, so with this one, we're going to be asking the client to walk in a straight line, placing the heel of one foot directly in the front of the toes on the other foot. So walking again, but heels first, because sometimes people walk with toes first. So I'm gonna put down the camera a little bit more. Can't see. Okay. So heel first, heel then toe, heel then toe. Okay. Again. Okay. So that is walking in a straight line, doing the heel to toe. Okay. So next is the toe or heel walking. So we're going to be asking the clients to walk several steps on their toes, then on their heels only. Okay. So first is on their toes. Parang doing a tiptoe, but not like a ballerina, because for that one they have a special shoes. So doing only the toes. So we're gonna walk a little high. There. Again. Back. Okay. Now with the heel of the foot. Like a penguin. Okay. So that is the toe or heel walking. So the next test will be for the fine motor test for the upper extremities of the patient or the client. So the first thing we need to do is the finger to nose test. So this is where we ask the client to abduct and extend the arms at shoulder level like this. Okay, and rapidly touch the nose alternatively with one index finger like that, then the other. So we have to have the client to repeat the test with eyes closed. So one with eyes open first, then eyes closed later. Then with even increasingly speed. So like this, since the doll cannot do it, I will be doing it. So for this one, okay, with the arms extended there. Now we're gonna be doing is this one, fingers to nose. Okay, 1, 2, 3, like that. Okay. Okay, now we're gonna be doing it eyes closed. Now faster. Then closed. Okay, so next, as we can see in there, as I have experienced, there is a bit of a difficulty when my eyes is closed because I am not aware where my hand is going. So since it is set in here and I got the motion, I got the hang of it while my eyes are open, it became a little easier. But if I didn't know, it's gonna be harder for me to actually locate where my nose is, where I can tap it. Okay, so next would be going back, as we can see it is coordinated, so alternate. So once the other is here, the other one is extended. So with that one, when it's going here, so there is a good coordination with what I am thinking na dapat ganito siya, then dapat ganito siya next. So that has a good coordination. So if the patient does the same, so they have a good coordination in their body. So next would be the alternate supination and the pronation to the hands and on knees. So for this one, so it's gonna be like this, like that, but on the knees. Okay, so what we're gonna be doing is I'm going to be doing it on myself again. Hold on. So it's gonna be like this, like that. So starting here. So what we're gonna be doing here is that we're going to be asking the patient to pat both the knees with the palm on both sides and then with the backs of the hand alternatively at an even, ever increasing rate. So this is, okay, we'll start like that. Then increase the speed. So as we can see, there is good coordination, even though it is going fast. So some patients have problems with finding their coordination. They may be lost. It may become like this, which is wrong. So in there, we have to record those. We have to document our findings. So in here, as I do it, like that, I have good coordination with my hand. But if a patient does like this, they get confused, we have to further assess them. Okay. Okay. So next we have the finger to nose, finger to nose, to the patient, to the nurse's finger. Okay. So with this one, we have to ask the client to touch their nose, then your index finger or my index finger as a nurse, as a student nurse rather, and held at a distance about 45 centimeters or 18 inches. Okay, so at a rapid and increasing rate. So for this one, we'll be needing the doll to act as the nurse, and I will be acting as the patient. So for this one, pretend this is the nurse's hand. So this is 18 inches. So what we're gonna be doing is like this. Okay, 1, 2, 3. Ready? Go. There. So from the fingers of the nurse to from the finger of the nurse to my nose, like this. So there's good coordination in there, even though it goes far, or this can be made harder when it is against resistance, or like when your elbow is flexed like this. So it becomes a little harder. Also, there are other ways to make it harder if it seems like it's just too easy for the patient. So it can be the nurse is changing the locations of the finger, of her finger or his finger, like that. Okay. So there, once it is done, and we have found that there is good coordination, then it's good results. Then next, what we have is the fingers to fingers. This is where we ask the patient to spread their arms broadly at the shoulder height. Then bring the fingers together at midline, with first eyes open, then eyes closed, then slowly, then rapidly. So again, like this, then midline, there, midline. So like that. Okay. So that is with eyes open, then closed. Okay. So as you can see, I have also felt that when my eyes are closed, I don't know where is really the midline. So one hand might become higher than the other, or they might not meet at all. So with that one, you really have to use your senses in there, like that. Like that. Okay, so now we have that one. We're gonna be doing the fingers to thumb, so with the same hand. So with this one, we're gonna be asking the client or the patient to touch each finger with the thumb of the same hand, then do it rapidly as possible. So it's gonna be like this, like that. Okay, the other one, like that. And you can do it both as well. Oh, wait. Like this. Yeah, like that. So, as you can see, when I do it just one by one, I can do it at a good rate or good speed. There. But if I do it together, I have this hesitation. I have this worry that it will not match. So I get a little anxious about it there. And sometimes my fingers don't coordinate. There. I might miss some fingers, like from here to jump in here. So my coordination actually is really not that great. Okay. So there may be other patients with the same condition. So with that one, we are done with the upper extremities of the fine motor tests. Now we'll proceed to the lower extremities. So now we're going to be testing the fine motor tests for the lower extremities. For this one, we have to ask the client or the patient to be on a supine position and to perform this task. So first, is to do the heel down opposite shin. So we're going to be asking the patient to place the heel of one foot just below the opposite knee, so and run the heel down foot. So para siyang, this is that, imagine this is the shin. Okay, this is the shin, then this is the lower, this is the knee, and this is the lower one. So it will be going down there like that, then the other side, like that. Then heel to foot, this, for pretend this is the foot, like that. So now it's gonna be repeated with the other foot. Then the client may also use a sitting position for this test. So pwede siyang sitting or in a supine position. So this is an example of it. Since the doll cannot do it, I'll be doing it. Just wait for a minute. Okay. So as you can see, I am sitting down. So for this one, wait, I'll do it. Okay, so for this one, so from the shin in here, going down, like that. For the other one, okay. This may be a tiring task, but just to ensure that we get good results later and good coordination. So there, as you can see, that is how the test is done. So with that, what we're gonna be doing is to toe or ball of the foot to the nurse's finger. So we're gonna be asking the client to touch your fingers with the large toe of each foot. So for this one, well, you can use the doll. Okay. So ma'am, I want you to touch my fingers with your big toe. Okay? Pump. Okay. Pump. Like that. So the toe is expected to move to touch your finger. So if it doesn't move, maybe there's something that hurts in the patient, or there's a problem with the movement of the toe, the big toe. So we can bring back that. Thank you, ma'am. Okay. So now what we're gonna be doing is the light touch sensation. So this is where we're gonna be comparing the light touch. So light touch meaning we're gonna be using a cotton only, so it won't be too harsh on the patient's skin or something. So light touch sensation of the symmetric areas of the body. So if we touch in here, we're also gonna touch in here to make sure that there is the symmetry of sensation with the client or the patient. Because there are times maybe that when you touch this area of the client, they cannot feel the same in the other one. So what that may be a sign of kinds of illness, or there's like this numbness in here, so where they really can't feel anything in that side. So with that, we're going to be asking the client to close their eyes, because when your eyes are closed, you can feel the sensation more, and so that we can ask the patient where they can feel the sensation. Okay, so once they close their eyes, they are expected to respond with a yes or no if they feel the sensation of the light touch. So with that, we're going to be getting a cotton in here, a cotton. So we're going to be doing a specific spot on the body. So we're just gonna, our really main goal in here is that we get a response from the patient, whether it is a yes or no, if they feel the touch like that, like that. Okay, so now we're gonna be testing them. For this one, we're gonna be testing the areas of the forehead. We'll get the patient first. Okay. First is the forehead. Ma'am, I'm gonna be touching your forehead with a cotton swab, just a cotton, okay? I made sure that my hands are clean with this procedure and the following procedures. Will that be okay? Okay, so ma'am, can you please close your eyes? We're gonna put the patient in a supine position with this one. So the eyes are closed. So wait, I'll just get this one so you can see the feet there. Okay, so first is the forehead. Ma'am, can you please tell me if you feel anything in your forehead? Yes, I can feel. Okay, that is good. So now we'll be moving to the cheeks of the patient. In the right side first. Ma'am, can you feel? Yes. On the other side. Yes. Okay. Now the hands. Can you please tell me if you feel any touch? Yes. The other side? Yes. Okay. Where do you feel those touches? In my hands. Yes. Okay. That is good in your hands. Now we're gonna be also doing the lower arm. So in here. So since they have a cardigan over, we're gonna lift it up. Ma'am, I'm gonna be lifting your cardigan up a little. Okay. Please tell me if you feel anything. Yes. Okay, the other side. Yes. Okay, that's good. So now we're gonna be doing the abdomen in here. Gonna expose it a little, but not fully exposed. So, ma'am, please tell me if you feel anything. Yes. Yes. Okay, so that is good. Next, we're gonna be doing the foot in here. Please tell me if you feel anything. Yes. The other side? Yes. Okay. How about this one? Yes. Yes. Okay. Where did you feel that, ma'am? In my foot and my lower leg. Okay, so that is good. So now we're gonna be checking specific areas of the limbs. So in here, maybe here. Yes. Yes. Okay, so that is good. So now we're gonna be asking the patient to point out the spot where the touch was felt. So, ma'am, I'm gonna do it randomly now. So please tell me if you feel it, okay? And where do you feel it? Okay. I feel it in my chin. Okay, that is right. How about here? I feel it in my palm. Yes, that is right. You feel it in your palm. How about in here? Yes, I feel it in my left foot. Yes, that is right. Last, ma'am. Yes, I feel it in my right knee. Okay, so that is very good, ma'am. So in here, if the areas, as we can see that the patient has responded very good, even where what kind of leg or which leg did she feel the light touch. So now what we're gonna be doing is if there is any areas where there is a sensory dysfunction, so it is where they can't feel anything in that area once you lightly touched it. This is to what we're going to be doing is to determine the boundaries of sensation by testing the responses about 2.5 centimeter or 1 inch in that area. So with that, we will make a sketch of the sensory lost areas for recording purposes. So for this one, if the patient says that, oh, I cannot feel, did you really touch this part, and they cannot feel, then we will be recording that. We will be documenting those as it is really important. So now, thank you, ma'am. Thank you. Okay. We're going to be proceeding to our next test. So now we're going to be doing the pain sensation tests. So for this one, we're going to be assessing the pain sensation as follows. So first is, we can do this by asking the patient to close their eyes and to say whether they feel sharp or they feel the pain, or it's dull, they cannot really feel, or don't know if they really don't feel it. Dull can be just light pain. So for this one, when a sharp or dull end of a broken tongue depressor is felt, or we can also do is that alternately use the sharp or dull end of the sterile pen or needle. So to lightly prick the designated anatomic areas at random. So for this one, face is not going to be included because it's a bit dangerous because it's going to be near the eye. So we're not going to be doing that. So for this one, of course, once you prick or do something because it's painful, allow the patient to have at least 2 to 5 seconds to before doing the other random spots naman. So for this one, I do not have a needle, a sterilized needle. So what I'm gonna be doing is a pen, and since this is a doll, we will be pretending if they feel the pain or not. But of course, if this is a real scenario, really use sterile needles. Okay, so for this one, ma'am, this is a pain sensation test. So I am really gonna be pricking some random parts of your body, but I will make sure that there is gonna be no blood talaga, little to no blood at all that will come out of your body, so you don't have to worry. So this will be just quick lang, ma'am, okay? Okay. So, do I have your consent to prick some parts of your body? Yes? Okay. So, once we have that consent, we're gonna proceed with the procedure. So, with this one, pretend that this is a needle again. So, I'm gonna be pricking this part. Oh! Okay, so does it feel sharp, or does it feel really ouchy, or does it feel just fine ouchy, or you don't feel any pain at all? But as I heard you said ouch, so does it mean that it is sharp or dull? Sharp. Okay, I'm sorry for that, but it is a great sign that you actually feel pain in that area. Because there are times where when they don't feel, there might be a condition talaga na parang nag-numb na talaga siya, or parang nawala na yung mga nerves nila doon. For example, if wala na yung third degree burn ka, so you don't really, the burn ng nerves, so you don't really feel the pain na talaga. So, with this one, it makes sure na parang, okay, they can still feel the pain. There's still nerves down there. Okay, ma'am? I'm gonna be proceeding with another one, okay? Okay. Okay, how does that feel? It just feels dull. I can feel that you pricked it, but it doesn't hurt. Okay, so that is good. So with this part, in this part, they actually have a bit of more skin than like, let's say, the legs, so it doesn't really hurt talaga in this part. So ma'am, I'm gonna be doing another part, last na po, okay? Okay. Oh, okay. So, ma'am, I heard that there's a bit of a delay in your ouch part. So, what do you mean by that? Is it sharp, or is it in a dull place? Because you said sharp, so I assume that you feel the pain, but you do not talaga. Okay. So, how do you feel? Is it sharp, too dull? It's not ouchy in the first, but the aftermath of it is a bit ouchy. Okay, so that is very understandable, ma'am. So thank you so much. If there is any blood, we're gonna be patching them up. We're gonna put Band-Aid, okay? Okay. Thank you. Okay. So that is how we do it. So again, if there is areas of sensory dysfunction, we have to determine the boundaries of the sensation. So by testing the responses about 2 to 5 centimeter or 1 inch, so in that area. So now we have to make a sketch if there is any parts nga that there is a sensory dysfunction. So now after that, we'll be moving to the next tests. So now, we're going to be doing the temperature sensation. This is where we're going to be asking, we're going to have the patient to parang just relax. Then what we're going to be doing is to touch the skin areas with the test tubes filled with hot or cold water. So this one is with hot water. Then I'll be getting the other one. This one is with the cold water. So we have to have the patient again. There, ma'am, please see. Okay, thank you. So now what we're going to be doing is to have the client respond to say, we're going to be touching some of her parang body parts with the test tubes. um, and whether they say is it hot or is it cold. Okay. Okay, ma'am. So with this one, I have test tubes in here. They're quite big, but let's pretend that they are test tubes. So with this one, this is a cold water, and this one is a hot water. So I want you to say if you feel any hot or cold in that area, or you don't know. Okay? Okay. We'll start with the cold. Oh, is it cold? Yes, it's cold. How about in here? Is it cold? Yes, it's cold. How about in here? Ooh. Is it cold? Yes, it's cold. Okay, now we're gonna be proceeding with the hot. So with the hot test tubes, you have to be careful, okay? So, ma'am, this is gonna be just slight lang. Hot. Is it hot? Yes, it's hot. Hot, hot. Ah, yes. You feel that. Okay. Hot. You feel? Okay, so it is hot. Confirmed by her, by the doll. Okay, so now we assure that, you know, the client can sense have this sense of hot and cold in their body. So, for example of this also is whenever the patient or the person is taking a bath. So, with that one, you can feel the cold talaga, diba? But there are other people who really doesn't feel the cold. Maybe because of their environment already that they grew up in. Like, for example, there are people in Baguio that just goes out without wearing proper cold clothes for cold season. So maybe they have adjusted to that environment already, to the point that they don't feel the coldness, that it becomes normal to them that it is really cold. So there are really conditions and people like that. It really depends on your environment and, you know, your condition. If you have an illness with you being parang cold easily, like that. Okay, so now we will proceed to the next assessment. So next we have the position or the kinesthetic sensation tests. For this one, commonly the middle finger or the big toe is, or the large toe is used for the tests. So what we're gonna be doing is to test the fingers. We're gonna be supporting the client's arm with one hand and hold the client's palm with the other. So with the toes naman is that we're going to be placing the client's heels on the examining table. So for this one, we're going to be asking the client to close their eyes. So while we do this, diba, we're holding it. So what's going to happen is that we're going to be grasping the middle finger with the thumb and your index finger like that. So with that one, you're going to be exerting the same pressure in the other side. Then, so it's going to be in your toes. So for this one, we're going to be moving the finger. Moving the finger until it is up or down, or is it straight out like that. So for this one, we're going to be asking the patient what is the movement. Okay, what is the current movement of the finger or the toe? So we use a series of brisk up and down movements before bringing the finger or toe suddenly to rest in one of the three positions. So for this one, we're gonna be using the doll. Okay, so there. Okay, so ma'am, I'm gonna be now holding your foot. Okay, so we're gonna be starting with your foot first, okay? Okay. So I'm gonna be grasping this one. Ma'am, I need to ask you to here na lang para it's much clearer. And here. Please go down. Yeah. Okay. Example, this is the okay. So ma'am, I'm gonna be needing you to close your eyes, okay? Okay. So for this one, make sure that they are lying down properly. Okay. Ma'am, I'm gonna be touching your toes, okay? Okay. So, start with one foot first. Okay. Okay, ma'am, can you tell me which is it going? Which way is it going? Your large foot, a large toe rather. It's going up. Now it's going down. Then just straight. Okay, good. The other foot. Up, down, straight, down, down, up, straight, down, up. Okay. Rest this one. The other foot again. Up, down, straight, up, down, straight. Okay, that is good. Now we're gonna be doing it in your hands, okay? Okay. So, please tell me the direction. Up, down, straight, up, down, straight. Okay, the other hand. Up, down, straight, up, down, straight. Okay, so you did good, ma'am. So please sit down again. There, okay. So we can see that the patient has good coordination with that one. So now we're going to be doing the next test, which is the tactile discrimination. So for this one, we're going to have the patient have their eyes closed for the whole session, for the whole assessment in this part, okay? So next, what we're going to be doing is the tactile discrimination. So again, this is where the in the session, this is where the eyes of the client is closed. Okay, so first we're gonna do the one and 2 point discrimination. So for this one, it's gonna be alternately simulate the skin in here with 2 pins simultaneously and then with 1 pin. So we're gonna be asking the client whether the client feels 1 or 2 pin pricks. So in here, instead of the needle, I thought of just doing a little pinch. Okay, ma'am, tell me if you feel anything. Okay, so what do you feel po? I felt 2 pricks in my, or 2 pinches in my arms. Okay, that is good. Okay, so now we have that one. What we're gonna be doing next is the stereognosis. This is where the we're gonna be placing familiar objects such as a key, paper, coin, or a clip. Okay, so in the client's hand while their eyes are still closed, then we're going to be asking the patient to identify what are those items. So if the client has a motor impairment, like they cannot grasp or hold the object, what we're going to be doing is that we're going to be writing a number or a letter on the client's palm using the blunt measurement, and ask the client to identify what is written on their hand or in part of their skin. Okay, so for this one we can do both, so to show them how it's done. Okay, so we're gonna start. Ma'am, please close your eyes. To close the doll's eyes, I'm gonna be laying it down so it's closed. So I want you to be feeling this spot. Okay, this is the first item. These are my shoes. Okay, so that is good. That is your shoes. Next, how about this one? These are there's bristles. Comb? This is comb? Yes, this is a comb. How about this one? Oh, it's like a cloth. Okay, there's a string. This is a face mask. Yes, you're right. This is a face mask. So those are the 3 objects. Now we're gonna try to write na lang. Okay, if in case they have an impairment. Okay, we're just gonna show it. Okay, Ma'am, I'm gonna be writing on your hand. So can you please tell me what do you feel or what letter or number do you think I wrote? Okay? Okay. You wrote number 7. Yes, you are right. Next, you wrote letter A. Yes, you're right. How about this? 0 or O? Yes, you are right. So, that concludes the stereognosis test. So, after we did everything, we're going to be documenting our findings in the client record. So, that is it for the neurological system assessment. I am Marjorie Dela Rosa, a student nurse in Brokenshire College. Thank you very much.